Okay, so as promised, here's my Medicare 101 step-by-step, what you need to know about Medicare, including pictures that you can relate to. If you have a copy of our brochure, you can use that as a go-by as well. And if you don't, then please go to lowcostcahealth.com and you'll be able to download a copy there. Or give us a call or email, we'll be happy to send you one. So this is my name, contact information, and how you can reach me. I work at DCD, Financial and Insurance Services. And here's our phone number and my personal email address. Just so that you get an overview of Medicare, especially here in California, we have over 10,000 baby boomers turning 65 every day. So if you're trying to call Medicare or the Social Security office, understand that they're a little bit busy. And as the baby boomers are retiring in droves, so are those workers in those particular places that have a lot of experience. They're retiring and going on to Medicare just like you are. So the odds are good that you may be talking to somebody on those 800 numbers who just got hired recently. So know that your experience may vary using those numbers. About 32% of people who are Medicare age at 65 are still working or getting their insurance from their employer. Some of you may already be retired and on Social Security. So many of the answers and how, when, where, and why, depending on which one of those sets of brackets that you're in. So we'll go over both of those, but many of the things, regardless, are exactly the same. So do you need to apply for Medicare Parts A and B, or is it just going to show up? Well, it depends. You don't need to apply if you're already receiving Social Security benefits. Typically, your Medicare card will arrive in the mail about 3 months before you turn 65. However, note if you move around, make sure that the address that Social Security has for you is correct. But you do need to apply if you're not currently receiving Social Security benefits or you delayed taking Part B coverage because you had insurance from your employer. When to enroll in Medicare Part B? When you turn 65 or when you retire and lose your group health insurance. If you're not sure about your insurance at work and what your needs are with Medicare, please contact your HR or benefits administrator to find out how your insurance works with Medicare. But for most of you, if you're 65 and you're not on employer coverage, you do need to enroll in both Parts A and B. How do you do that? You go to the Social Security website, which is ssa.gov. Highlight Benefits. Look over on the first column and click on Medicare. And then if you're just new to Medicare, go ahead and click on the Apply for Medicare Only. If you're over 65 and you've already had Medicare Part A, but you're applying late for Part B, then go to the box down lower where there's a form CMS 40B. Of course, the government, they have to have a number for every form. Fill that out, it's real simple, and then have proof of your medical insurance. Take that down to your local Social Security office. They can get you enrolled in Medicare Part B to make sure that you do not get a penalty. So for those of you who are enrolling new for Medicare, go ahead and click on Start a New Application. You're applying for yourself typically. And then provide your name, address, date of birth, some basic information. Make sure that you go all the way to the end of the process and get a completion message, not just an assigned number. If you can also do this by calling your Social Security office or making an appointment at your local Social Security office to do this. So here's my Medicare 101 presentation. Again, this can be done on a cocktail napkin, plain piece of paper, but it helps you keep all the different pieces of Medicare together in your mind. So we have 4 boxes, a great wall of China squiggly mark right between the second and third. That divides our paper into the government side of the world and the private insurance plan side of the world. So you'll see that you have 2 boxes on each side. So on the government side, that's our original Medicare, which comes with 2 different parts, Part A and Part B. Part A is your hospitalization coverage. Part B is coverage for outpatient services like doctors, labs, x-rays, MRIs, and even outpatient surgeries where you have a surgery and then go home. You'll have a red, white, and blue Medicare card that actually has, sadly, your Social Security number with a letter designation behind it and the dates that you elected Part A and Part B. If you get both at age 65, this is an identity theft waiting to happen. So do make a photocopy of this card, black out the first 5 digits of your social, and carry only the copy in your wallet. Leave the original at home. There's going to be some holes in that coverage, which we'll discuss further, and that's what we will go over to the private side of the page to find a Medicare supplement or drug plan to fill those holes. So again, your hospital coverage in Part A, Medicare will pay everything except $1,288 as a deductible if you're hospitalized. These are typically overnight hospitalizations or longer, and that includes your surgery, your doctor, your food while you're in the hospital, a semi-private room, and so most things are actually quite reasonable even with just Medicare. If you are in the hospital more than 60 days, a $322 per day charge starts happening from day 61 through day 90. Skilled nursing as a rehabilitation is only available if you're hospitalized for more than 3 full 24-hour periods. And for the first 20 days, if you have met that criteria, then that is at no charge to you. But after day 21, it starts to be $644 per day. It's important that we know what these holes are, not to scare you, but so that you can understand the Medicare supplement that you need on the other side. In Part B, that's your outpatient care coverage. There's only a $166 annual deductible as of 2016. And then Medicare pays 80% of the Medicare allowed charges, which are negotiated to be quite low, and then you pay 20%, plus up to a 15% excess charge should your doctor not take the assigned Medicare rate. So this gives you kind of a real general overview of what the holes in Medicare are, and then we'll jump over to the private side to fill those Medicare holes, and also to get a prescription drug plan, which note neither Part A or Part B covers outpatient prescription drugs. This is the chart that I have up on my wall. I have to keep whiting out and updating as things change over the years with the deductibles, but essentially it's standardized and the information stays very much the same, except for slight increases in the Medicare A and B deductibles and the costs for Medicare's Part A and B. Most of you have worked more than 40 quarters and you get Medicare Part A for no charge. If you haven't and you're a U.S. citizen, you can purchase Part A, and there is a charge that's related to that. Medicare Part B, as of 2016, most people will pay $121.80 for this. If you're on Social Security, then that will be deducted from your Social Security check. If not, you'll be billed by CMS for that amount each quarter. So let's take a look at what the Medicare supplements are and those drug plans and how we can choose them for you. This is a standardized chart that you'll see in every Medicare book that's shown up in your mailbox. It's there somewhere, and you'll see that the government, not very original, name all of their different plans by alphabet. And regardless of what insurance carrier you purchase these from, a Plan F is a Plan F. A G is a G, a K is a K. They are very standardized plans. You'll see that Plan F is the one that covers 100% of all the things that are left over from Medicare. I often tell my clients, think of any parade that you've been to. You know, the ones with the horses and the elephants. You know what those things leave behind, right? Little road apples left, and there's always some poor guy with a garbage can and a shovel trying to pick that up. Medicare is the horses and the elephants. And these Medicare supplements are the little pooper scooper guys at the parade. So if you want them to pick up 100%, then Plan F is your Cadillac plan for that. There's also a version of that plan that has a deductible that's extremely affordable and a great choice for many. We'll go into these further, and especially when we meet one-on-one, but this just gives you an idea. Also note, there are things that Medicare just does not cover, and if they don't cover it, the Medicare supplement won't either. So things like long-term care insurance, basic vision, dental, hearing aids, eyeglasses, or private duty nursing. These are things not covered by Medicare or the Medicare supplements. So go ahead, give me a contact, and you can email, call me, and we will be happy to sit down, have a one-on-one conversation, see what it is that's important to you, and make sure that you get taken care of. We're not here to sell you anything. We're here to teach you about what the options are, educate you on that, and then assist you in enrolling in whatever it is that you prefer. Thanks for listening. And again, if you don't have a copy of the brochure that goes along with that, please email me or give me a call, and we'll be happy to get one out to you.